Ladies and gentlemen, we now come to a presentation that is closely allied with the one presented by Ms. Malavika Sarukai in many ways. It addresses the nitty-gritty of what exactly dancers do by way of fitness, exercise and diet to look and feel better and dance better. There is often a belief that Bharatanatyam is exercise enough. Also, warm-up and stretches are not exactly part of traditional training for Bharatanatyam, though it is now in many schools, but it wasn't. For example, when I was learning from my guru, we never started with a warm-up or stretches, we just went straight ahead and danced. Regarding our diet, dancers never know when one has to avoid carbs or should one live on salads and fresh air, or eat normal for the amount of dancing we do. As a doctor, one thing I've always wondered about my fellow artists, do they take as much interest in their health as their dancing? Apart from diet, exercise and fitness, what about having annual health checks after a certain age? I know as artists, we all live in a different plane of creativity and imagination and planning new programs, and we live in a world of music, poetry. But what about screening for preventable disease? In fact, I would like to take this opportunity, this forum, as a personal request to all artists to focus on remaining healthy to dance forever. Busy schedules, travel notwithstanding, please put health first. To address some of these issues and more, I welcome Dr. Sheela Nambiar to stage. Born and brought up in Ooty, Dr. Sheela Nambiar trained to be a gynecologist in Madras Medical College, was my senior in fact, completed her MD in Obgyn and currently works at her own hospital with her mother in Ooty. She went on to train as a fitness and lifestyle consultant from the National Association of Fitness Certification in the US and started using fitness and lifestyle medicine as an extension of her medical practice. She runs a program called Training for Life, consults, teaches fitness classes, and conducts workshops. Welcome, Dr. Sheela Nambiar. And at the end of the session, I only have one request. Questions and queries, since we are really in a very, very tight schedule today, I have requested Dr. Sheela that you can address all your queries and questions that you may have for her. You may have many, to our Natyakala conference email ID, and I will make sure that she responds to you and carries the conversation forward, which might be perhaps more meaningful than the questions and answers here. Thank you and welcome, Dr.
Thank you, Srinidhi, for inviting me here to talk on a subject that is very, very close to my heart, holistic wealth and wellness for women in general, and in this particular context, for dancers. When Srinidhi invited me to talk about fitness for dancers, it occurred to me that my profession calls for a certain amount of practicality. Much as I love art and philosophy and all of that, it requires me to look at the very practical aspects of what it is to perform in your case, and to perform in other ways to improve functionality on a day-to-day basis. As a dancer, I would imagine that all of you know dance is a form of, is poetry in motion. And as a dancer, you are privileged to showcase the human body in all its beauty and be able to take it to new heights, to be able to perform the kind of movements that you do, to be able to demonstrate to us over and over again the sheer magnificence of this human body. The dancer epitomizes the beauty of the human form. But Here's the caveat. Dance itself requires that you perform a certain movement, certain movements, over and over again. This repetitive movement that is performed during your practices and during your performance itself can put a certain amount of stress and strain on the muscles that are involved, and more specifically and more importantly, on the joints that are involved. Dance also requires you, lower this light, it's too bright. Dance also requires that you hold certain technically and biomechanically unnatural movements, scientifically unnatural movements for prolonged periods of time during your practice and during the course of your performance. And it requires you to perform for long periods of time under hot lights such as these, which I wish they would lower a little bit. It's really hot. Under hot lights with heavy makeup, beautiful clothes, heavy jewelry, and all the while look beautiful. So it is a sheer test of endurance for a dancer, and I think all of this requires that one is fit, that one is fit in many different aspects, which is what I'm trying to explore today. So the three main questions that I'm addressing is dance enough to keep you fit? And as a dancer, just because you dance, are you fit? Is dance enough to keep you injury-free, which I think is the worst nightmare for any dancer or any performer? And very importantly, is dance sufficient to prevent weight gain? Is dance enough to keep you fit? The short answer to all of those three questions is no, it's not. Over a period of time, dance and the physical movement that a dancer performs becomes somewhat what we call as activity rather than physical exercise. It may be, a dancer may be more physically active than, let's say, somebody who has a sedentary desk job. However, over a period of time, that very physical movement that she performs during her practices, which may increase just before a major performance, but by and large, her body acclimatizes to that extra movement and it becomes physical activity. It's not exercise anymore. And in order to counteract these repetitive movements that I had mentioned, one would need specific exercises to address those muscles that perform the movements and also the muscles that counter those movements in order for there to be balance in the body. Because like I mentioned, there is certain technical malfunctions, malpositions that a dancer holds, which I will explain, which can produce wear and tear, specifically on the joints, over a period of time as the dancer ages. We need to strengthen related and opposing muscles, especially to protect the joints that are involved. The core of the body, what we call the core of the body, is not just the abdominal muscles. It includes the muscles of the abdomen, the back, upper and lower back, the deeper muscles, the smaller, intricate muscles of the shoulders, and importantly, the muscles of the pelvic floor. And this core of the body is what forms what we would call the scaffolding for the body as the dancer moves through their various rhythms, and as the center of gravity shifts from second to second, as we've seen, and when the center of gravity differs from the stability that she has placed on the ground, where her upper body is completely not in alignment with her lower body, it's the core that takes the strain. And unless this core is strengthened specifically, the rest of the body, such as the low back, can take the strain. And dancing by itself, contrary to a common belief, dancing by itself will not strengthen the core. One needs to specifically address these muscles in order for them to be strengthened. Is dance enough to keep you injury-free? No, in fact, dance can lead to injury. The repetitive motion, like I said, can lead to a strain and stress on specific muscles and specific joints, which in turn, over a period of time, can cause injury in the long term. I've seen that those in certain performing arts, runners, athletes who practice a certain sport, or sports people who play a specific game, develop muscle imbalances that are very typical of their sport or their art form, simply because of the movements that they repeat over and over again. And this is part of their profession. It's something that they have to do. It is something that they are trained to do. But in order to be able to do it better and to prevent injury, they will need to strengthen the specific muscles that are involved. Joint injury, injuries to the knee and back, I find are very common with athletes, sports people, dancers, and even the gait and the muscle imbalance that is very, very common with specifically dancers. And I have found that with Bharatanatyam dancers, there is a certain bowing of the legs, which comes after a period of time, unless counteracted using specific exercise protocols, perhaps because of the position that they are accustomed to during their practices. So that becomes almost like a natural gait to them. Take, for instance, the Aramandi, or the demi-squat, which is very commonly practiced and is a part of your repertoire. Technically and biomechanically, this is not a scientifically correct position, simply because of course you have to do it in your dance, and this is what is required of you, and that is the beauty of your dance, the fact that it's not technically and biomechanically correct. But the fact is that this movement, for instance, puts a lot of pressure on the knee joint. The stress and the shear forces of the upper body, particularly if it is heavy, is directed at the knee joint, simply because the knee, as you can see, is traveling beyond the level of the toes. When we teach fitness and we teach what is called as the squat, which is considered the king of all exercises, we teach it in a way where the knees remain within the level of the toes in order to strengthen the thighs and the buttock or the gluteal muscles. So it's not to say that you have to change your Aramandi, but the point is that to do a better Aramandi and to prevent these shear forces from injuring your knees over a period of time, you would need to train the muscles of the thighs, the gluteal muscles, to protect your knees as well as your ankles. So this is a picture of the knee joint. A joint is the point where two bones abut. Not changed it till now? Oh, I'm sorry. Sorry. Oh, could you just go back very quickly? No, this is, yeah. A knee joint. The next one. Yeah. So I'm sorry, I wasn't looking at the screen. Yeah, sure. So this is the knee joint, and this is the point where the two bones abut. It is supported by the ligaments, what is called as the ligaments, which are part of the muscle, and rope-like structures called, ligaments which are rope-like structures, and tendons which are part of the muscles. So the knee joint by itself does not have muscular support, but it is surrounded by muscles and tendons which can protect it. And the exercises need to be used to strengthen these muscles, ligaments, and tendons which surround the joint. As otherwise, there would be a great deal of pressure on the joint itself, causing some amount of erosion of the cartilage which is present between the joint, between the two bones, and injury to the menisci, even injury to the ligaments, anterior cruciate, posterior cruciate ligament, etc., which is very common in sports, especially contact sports like soccer. And in the case of Bharatanatyam, the ligaments are put under a great deal of strain. Tendons and ligaments are put under a great deal of strain because of those shear forces that I had mentioned, which are directed to the knee, to the joint itself. So some of these biomechanically unnatural, technically unnatural positions, which are beautiful to look at, can produce a lot of injury to the dancer herself, unless otherwise specifically trained and countered. So is dance, the all-important question of, is dance enough to prevent weight gain? It certainly is not. Because like I said, over a period of time, the dancer's body acclimatizes to her increased physicality, increased number of calories that she burns. And the human body is so clever that it balances out this calorie ledger by compensating the intake and the expenditure. And dance becomes activity for a dancer. What is important with weight gain is nutritional balance. And like I said, we do tend to imagine that even if we continue eating the same amount, which of course we don't, same amount as we did when we were younger, we will remain the same weight. But that's not how it works. Simply because with age, there is a certain decrease in what we call as the basal metabolic rate, which is the number of calories that one burns even while seated, like all of you are. So a person who ages has a lower muscle mass, simply because a sedentary position, and unless specifically trained, we actually lose to the amount of about 0.5 to 1 kilo of muscle per year after the age of 30 to 35. I would imagine younger because of the kind of sedentary lives that we lead. And we compensate by adding and accumulating 1 kilo of fat every year after the age of 30 to 35. So basically your body composition changes with less muscle and more fat. So a person who does not specifically increase or attempt to increase the amount of muscle that she's building will lose the fat as she ages. So these are some of the muscles that lie beneath the skin of the human body. Done. Change. But we don't see that, do we? What we see is the human body clothed in its skin, covered with beautiful clothes, makeup, jewelry, and so on and so forth. We don't see, and we are not aware of those ropes and those wires that are creating these beautiful movements. All we see is the exterior, and we could be causing a great deal of damage to this internal workings of the body if we don't pay attention to it. So muscle, next. So muscle is, for a dancer, I would think, one of the most important organs, because that's what helps her move and perform the art that she is so good at. And the interesting thing about muscle is that it can be controlled, it can be grown, it can be developed as the need arises, and depending on the kind of protocol that one follows. But it can also deteriorate and literally disintegrate with age. Like I said, almost 0.5 kilo to 1 kilo after the age of 30, compensated with the increase in fat. So how does strength training help? Strength training is the use of external resistance. It could be in the form of machines, it could be in the form of dumbbells, free weights, and so on, or even one's own body weight. Challenging the muscle is what helps it to grow. And this challenge of muscle only happens when we apply external resistance to it. So improving strength by strength training builds strength in these muscles. It counters muscle imbalance that I had spoken about, and improves the aesthetics of the body, because the real shape of the human body is truly seen only when the muscles are better defined and developed to the ideal extent. It also, in the case of the dancer, helps prevent injury, and as I have explained in my second book, Gain to Lose, the development of muscle and the strengthening of the muscle and the growth of the muscle also aids in losing fat, because the muscle is what we call metabolically, next one, metabolically active tissue in comparison to fat, which is metabolically inert. In other words, muscle burns calories even while seated. Muscle requires energy to function. Fat doesn't. Fat is the storehouse of energy. And these two samples of fat and muscle weigh 5 pounds each, exactly 5 pounds each. And as you can see, fat occupies a lot more space than muscle. Muscle looks much leaner, although it is much heavier. So an individual who has more muscle will appear leaner, appear more toned, although the weight may be the same as compared to somebody who is much fatter, or rather carrying more fat, but maybe of the same weight. And similarly, an individual who looks slim and who is carrying fat may weigh less, but would not be as fit and have as high a quality of body as somebody who is trained and more muscular. Does strength training, now this is a question that I'm always asked, especially by women, does strength training make you look masculine? Does it make you look bulky? It's testosterone and not lifting weights that creates the facial hair, deeper voice, and the masculinity. Weight training cannot do that. I imagine that the reason this question is asked is when you talk about weight training and you talk about strength training, the visions that come into mind are the images of bodybuilders. But the point is that bodybuilding is a sport by itself, and a bodybuilder spends several hours a day, just like a dancer spends several hours a day practicing dance. A bodybuilder would spend several hours a day practicing and training to look the way he or she does. In addition, of course, there is the advent of performance-enhancing drugs, steroids, and so on and so forth. So you can look like a bodybuilder if you train to that extent. But here, the objective of strength training is to improve strength and aesthetics, and that would require a completely different protocol, a completely different investment of time and energy. And no, you will not look masculine. Instead, you will look better, leaner, toned, and also be able to function better. And the female body, because it has a lower amount of testosterone, will, and also inherently a lower muscle mass, lower amount of muscle mass when compared to a male body, is very unlikely to become like a bodybuilder unless she specifically trains to. And the unique problems that we Indians face is sarcopenia, which is we are born with less muscle when compared to our Caucasian counterparts. And this itself predisposes us, it has been found, studies have shown that it predisposes us to various problems such as increased abdominal fat, which we've even named killer belly disease, an earlier advent of diabetes, heart disease, early death, and so on and so forth. So the answer to all those three questions, is dance enough to keep you fit? Is dance enough to prevent injury? Is dance enough to prevent weight gain? The answer is no, it's not. And what is required is a separate and specific fitness schedule and protocol. And weightlifting is most definitely part of it. World over, athletes, dancers, sportspersons are all taking and understanding that other aspects of fitness are as important, that weight training makes them stronger for their required sport. It prevents them from getting injured. It makes the particular sport or the dance easier, as you will find it easier to lift your body as you leap across the stage or leap across the court. You look leaner, and strength training, building muscle, has been found to be anti-aging. Who doesn't want to stay young? And this has been found at the very molecular level. It's not just the aesthetics or the physical level, but at the very molecular level, where a study done in Australia took biopsies of individuals who had trained for 6 weeks with weights to strengthen, and those who had not, after 6 weeks of not training, and they found that those individuals who had trained with external weights to build strength, the very molecular structure of the muscle, the very cell had been altered. The mitochondria, or the powerhouse of the cell, had been altered. So the anti-aging altered to be younger, to be more to have less free radicals and less injury and age-related disorders. So at the very molecular level, strength training and building muscle helps to prevent. And of course, there is a sense of empowerment and strength with while following strength training routine, which cannot be explained. It has to be experienced for it to be actually felt. Yeah. Next. And Andrea Correa et al. In the International Association of Dance Medicine, the Journal of the International Association of Dance Medicine says some dancers are reluctant to engage in any training that they perceive might compromise aesthetic quality. They fear that strength training in particular may lead to bulky muscles and loss of flexibility. However, there's little evidence to support this notion. A number of international studies for dancers have similarly found that supplemental training need not create a bodybuilder type frame, but can rather enhance the abilities of dancers while maintaining their aesthetic principles. Dancers and weight gain is I know, the focus for anybody in the performing arts because of the focus on physicality and the audience expectation of physical beauty, the pressure to look a certain way. And I know that a lot of young dancers feel that pressure to not just to perform, but to look a certain way. And unfortunately, some of them do take to, not just dancers, but sports people do take to unscientific means of trying to lose the weight using unhealthy weight loss practices, starvation, what they call as detox. The body, by the way, can detox itself. You don't need to do anything specific to detox it. So all these practices that people try and follow to to lose weight or to stay in shape are really quite unnecessary and detrimental, in fact, to the body. The only way one can actually change the content and the quality of the body is to follow a proper scientific fitness routine and, of course, follow a proper nutritional plan. Because as we all know, weight is 80% nutrition and only 20% exercise. And when I say follow a proper nutritional plan, I don't mean starving yourself or eliminating one food group completely, doing away with your carbs completely to get into the ketogenic phase and all of that. It may not be practical, particularly in the Indian scenario where our food is replete with carbs. So how do you manage to change that around, and how do you manage to eat what we would call an optimal balanced diet while still getting the necessary nutrients? It is a science, and it requires a certain understanding of food and a certain understanding of the food groups and the number of servings. It's not difficult, and you don't need a degree in nutritional science, but it does require a certain amount of dedication and focus rather than getting diet sheets that tell you just what to eat and what not to eat from dietitians, being dependent on people to tell you don't eat this and eat this at 6 a.m. and eat something else at 11 a.m. Understanding food for yourself and understanding what you put into your mouth, to me, seems to be the most critical and sensible thing to do to keep your weight in check. And here's what Catherine Morgan, the New York City Ballet dancer, had to say about gaining weight. When she was asked, do you experience any direct pressure to be thin during your time as a professional dancer? I think every dancer does. You're looking at yourself in the mirror every single day. I tell people who are not dancers that it's like being in a bathing suit all day long. So you definitely feel the pressure. And then there are some people who are naturally thin, and the director sees them as the standard because they're rail thin and everyone else doesn't quite measure up. So you can be lean and strong, you can prevent fat gain, and you can prevent injury if you do the right things and you follow the right fitness protocols. It would be remiss of me if I didn't say that strength training is only one of the 4 pillars of fitness. Stamina, flexibility, and muscle endurance are the other 3 pillars, which also need to be included into your fitness regime in varying proportions and varying amounts depending on your goals and objectives. And dance, as you know, as an art form, I think particularly for women, requires a lot, not just dedication and discipline, but a lot of other societal pressures because of the multitasking and because of the performance anxiety, because of the pressure that society puts on her to look a certain way and to be a certain way and to perform a certain way. So all of this, I would imagine, requires a huge deal of strength. And for me, as an obstetrician gynecologist, dealing with women through their various stages of their life, starting from teenage right up to pregnancy, post-delivery, menopause, and beyond, the one common thread that I see amongst women is their emotional strength and enormous amount of fortitude. But today, I wanted to bring about and talk about a different kind of strength, the strength of the physical body, which is also essential in order for you to be able to take you forward to lead a better quality of life. And on a final note, to all dancers, I would say be kind to yourself. There is a lot of pressure that you put on yourselves simply because it is expected of you to be and perform and to be beautiful. And for instance, a sports person would probably be applauded for the sweat dripping down his brow, as Srinidhi said, and be applauded for looking exhausted and fatigued on stage, whereas a dancer has to do all of that and continue to look beautiful on stage. So it is a daunting task. A dancer needs to learn to heal rather than push through injury, and I do know that many of dancers who injure themselves during practice, they are compelled to push through the injury and compelled to perform, and that in itself causes other problems because the compensatory muscles come into play and try and take over the injured muscles, which in turn leads to muscle imbalance. And of course, learning to prevent injury would be the ideal, and the way to go about that is to train for strength, improve fitness levels, and do follow protocols that are individualized for you, because there are certain muscles that would be overused and other muscles that would be underused. In a Bharatanatyam dancer, for instance, the quadricep muscle or the front of the thigh is overused due to her positions, whereas the hamstrings and the gluteal muscles are highly underused. So constant Bharatanatyam practice and performance will continue to overuse and overdevelop these muscles and underuse and underdevelop the opposing muscles and create a muscle imbalance which carries on to her later life as pain, injury, abnormal posture, and so on. You need to supplement strength training, definitely include flexibility training with modalities of fitness like yoga, cross-train, in other words, cycle, swim, and so on. Dancing is not sufficient as a form of exercise because it brings about, like I said, repetitive stress injury and calls into play the very same muscles over and over again. What you need to do is address other muscles which don't come into play during dance. And pay attention to nutrition, since that is what fuels your passion. I think you owe it to yourselves to stay fit and stay healthy, and owe it to us to continue to mesmerize us with your performances by staying healthy and continuing to dance late into your years. Thank you so much.
Thank you very much, Dr. Sheela. As always, very enlightening presentation. As I said, please mail in your queries to our conference ID or ask on our Facebook page by liking our page. Dr. Sheela? We now come to what some may say is an intriguingly named session, Economics of Dance. Dance is supposed to be divine, ethereal, and above all commercial considerations. But dance also needs financial support to flourish. One has to learn, one has to have the arangetram, then get the costumes done. There's the paying the remuneration to musicians, rehearsal, recording charges, it all adds up. Dancers need a source of income for this, and as we know, remuneration for dancers is meager. Teachers may earn, but not enough. In this scenario, when a young dancer asks me, can I take up dance as a full-time career? I'm usually tempted to shriek aloud, no. But I end up making very polite and subtle remarks that perhaps an additional career is needed to fund dance. Unless the family has the resources to endlessly support dancing without getting fed up. Top artists may have it different, or do they? To discuss this sensitive but vital topic, I now invite Srimati Geeta Chandran, celebrated Bharatanatyam artist, known for her deep and composite understanding of the art of Bharatanatyam, for her proficiency in Carnatic music, her work in television, video, film, theatre, choreography, dance education, dance activism, and dance issue journalism. She is founder-president of Natya Vriksha, engages in performing, teaching, conducting, singing, collaborating, organizing, writing, and especially loves speaking to young audiences. So I'm hoping that this session will be also very vibrant, interactive, and with a lot of questions from our young dancers who have again come today in large numbers. Thank you for that. Welcoming Dr. Geeta Chandran to talk to us about the economic